So hello and welcome guys. Just give me a quick nod if the EV quality is clear, if I'm audible, if I'm visible, if the screen is clear. In the comment section you can just tell me if everything is going fine so that we are good to go and start with our today's session. We'll just wait for a couple of minutes for everybody to join in, and then we'll begin once I have a confirmatory nod from your end. All right. A confirmatory nod from your end. All right. I have got the confirmation. Everything is good. Everything is clear. So hi everybody. I am Dr. Hitesh Nathani, your mentor, your educator, your friend for the subject of anesthesia on this wonderful platform of Unacademy. So what we are going to be doing today in this session is that we are going to be discussing all the emergency case-based scenarios that we know, right? So we will start with CPR, also all the emergency case-based scenarios which are there. And how we are going to be discussing? We are going to be discussing those with MCQ discussion, right? So that it's live, it's interactive, and also it's helpful for us in the examination. All right, everybody. Hi, Paul. How are you doing? Hi, Mr. Khan. How are you doing? So welcome again. So before we start with our today's session, just a quick review of what all are the things which are going on our platform of Unacademy. Right, there is this 20% off which is going on Unacademy, right? As all of you are aware that today is the last day for this. This offer is extended till today, that is 31st of May. So whoever is targeting for the next year batch or for the FMGE batch, you can surely subscribe to Unacademy with this 20% off by using the code Dr. Hitesh. All right. And for the upcoming FMGE examination, we have this 3 months extensive course in which we'll be covering all the syllabus in detail, concise rapid revision, as well as MCQ discussion will also be there, right? So 200 plus hours is there. Everything would be covered in that for the FMGE examination, right? And also guys, for the upcoming NEET PG, right? Those who have given now, also those who are repeaters will give next year. There is this 9 months exclusive batch in which everything would be covered again: theory, TND, MCQs, everything, right? Also, if you feel like live, if you miss out on something, what are we supposed to do? There is this NEET PG Vitals which is there, right? In this you will have recorded videos of all the 19 subjects which is there already uploaded. You will have the PDF notes of that as well. The notes are being rolled out, and you will also be able to solve MCQs because we have recorded MCQs in that as well, right? Hi Yashvi, how are you doing? Hi Arjun, how are you doing? Yes, I am doing good, Mr. Khan. So yes, whenever we hear the name emergency, right? Whenever we hear the name emergency, what is the first thing that clicks in our mind? That emergency department or casualty of our hospital, right? So what all are the things that we need to know when we are talking about emergency? One, also when we are talking about emergency, when we discuss these basic things, if you consider it from the point of view of examination, you will have a question for sure. Plus in your clinical practice also, if you are well versed with the emergency case-based scenarios, this will help you to tide over the stressful situations which happen in your surroundings, right? So you should be able to balance between these two things very nicely. All right. So what are the things that we'll be covering under emergency case-based scenarios? BLS, ACLS, and ECG. What are these? All these would be covered under your CPR, right? ECG, it has already been covered in your medicine, but when it comes to some emergency in CPR, what are the kinds of ECG that you will be seeing? We'll covering that, right? Also, with regards to ECG, we will have this arrhythmias and acute coronary syndrome that we need to know of, right? What happens when the patient is brought to the casualty in unconscious state or in comatose state? What are we supposed to do as a medico that we have to know? ARDS, we have fairly covered it with the COVID case-based scenarios, right? When we discussed about COVID, right? So, but the ventilatory strategies with regards to ARDS and COVID case-based scenarios, we need to know of. All right. In surgery, abdominal pain has been taken care of, but reactions and complications like for massive blood transfusion, anaphylaxis reaction, anaphylactoid reactions, all these things we need to know of, right? So when we transfuse the blood, when we cannot ventilate, when we cannot intubate the patient, right? Local anesthesia, systemic toxicity, malignant hypothermias, which is a complication which can be precipitated by any drug that you give, right? Hyperthermia, thyroid storm, this can happen anywhere, right? And embolism. These are some of the emergency case-based scenarios that we'll be discussing today, right? As and when the time goes off, we'll be touching each and every part of it. Clear, everybody? But first and foremost, most important thing that we need to discuss today is your CPR. Everybody is ready for some MCQs on CPR? We'll solve MCQs and we'll learn CPR simultaneously. Alright? ठीक है? So first question on your screen. I hope the ECG is as well visible. I'll just move on to the other side. Yeah. An unresponsive patient in ambulance when attached with monitors showed the following rhythm. Right? What is to be done next? We will check for pulse and breath. We will start with chest compression and defibrillation. We will put the patient in lateral position. We will do cardioversion. What are we supposed to do in this particular ECG? Right? I hope the ECG is visible for all of you here. We'll just have a look at it. Alright. So what will we do in such scenarios? Give your answers in the comment section. Baljinder says it is option A. We will check for pulse and breath. Nice. What about the rest of you? What do you think should be done in such scenarios? Patient is unresponsive. Patient is unresponsive, right? Already in ambulance and monitors are attached, right? Monitors are attached. What are we supposed to do? Chatora Insan says option D, that is we'll start with cardioversion. Yes, anybody else? What will be your answer? First of all, let me know in the comments, guys, what Paul says defibrillation. Very good. Hi Medico VH, good afternoon. Hi Gayatri, very good Gayatri, option B. Nice Baljinder, now you are telling option B, that is really good. Yes Dr. Khan, it is correct, it is option B, right? First of all, what is the rhythm, guys? Tell me what is the rhythm? What is the rhythm here? It is ventricular fibrillation, right? ECG also we have to know, right? So what is the rhythm? It is ventricular fibrillation, है ना? So going back to the basics, right? Going back to the basics of CPR, when the monitors are attached, right? Since your monitors are already attached, we have already known that, right? When the monitors are attached, particularly ECG, yes, you will get two types of rhythm, right? One is shockable rhythm. One is shockable rhythm. Second one is non-shockable rhythm, right? Second one is non-shockable rhythm. So what are we supposed to do and which are shockable rhythms, guys? Yes, Gayatri. Yes, Baljinder. Which are shockable rhythms? It is VF and VT, right? VF and VT are shockable rhythms, right? What about non-shockable rhythm, guys? Which are non-shockable rhythms in which you cannot give the shock, in which you cannot defibrillate? Which are those rhythms? Asystole or asystole and pulseless electrical activity. Asystole and pulseless electrical activity are non-shockable rhythm, right? So in shockable rhythm, whenever you get a shockable rhythm, because here ECG is attached, the first thing that we have to do is to deliver shock as soon as possible, right? and then we will continue with CPR, right? Then continue with CPR, right? CPR is already ongoing. You've attached the monitors. You see on the monitor that it is a shockable rhythm, that is VF or VT. So first thing that you do is give the CPR and or give the shock and continue with CPR, right? Whereas in non-shockable rhythm, you just keep on giving CPR, right? You just keep on giving CPR. So what is the answer here? We'll continue with the chest compressions and defibrillate as soon as possible. Give shock as soon as possible, right? Very good, guys. Yes, exactly correct. So this is the answer, right? We will continue with chest compression and defibrillate as soon as possible. There are two important things take away here. One, the patient was unresponsive, pulse was not felt, monitors were attached. When monitors are attached, it becomes ACLS protocol, right? So in ACLS, you deliver shock as soon as possible. In BLS as well, you try and deliver the shock as soon as possible, right? But we have AED there. In BLS, we have AED. All right. So why not cardioversion? Why not other answers? We will look when we solve some more questions on CPR, right? In CPR, the number of chest compressions in adults per minute is 80 to 100, 60 to 80, 100 to 120, or 120 to 200 per minute, right? In CPR, the number of chest compressions in adults per minute, right? Per minute, how many chest compressions are we supposed to give in adults? Some people are saying option B, somebody is telling option C, some is telling C, right? Option. Chalo, if I change the question, right? If I change the question and instead of adults, if I ask you infants, what would be your answer, right? Instead of adult, if I ask you in infants, the number of chest compressions in CPR would be 80 to 100, 60 to 80, 100 to 120, or 120 to 200, right? What would be your answer? If B is for previous one or B is for this one? Yes. So I'll change the question a bit more, right? Instead of infants, I'll write a child. Instead of infant, I'll write a child, right? So what would be your answer now? A child who is like 6, 7, 8 years old, right? What is the number of chest compressions will you give in a child who's 6 to 8 years old, right? How many is the number of chest compressions for that? 60 to 80. Pistachio says option C. Bhavnesh says infant also 100 to 120. Nisi says 60 to 80. Sumit says same C, right? So in child, what would be your answer? All right. So whether it is adult, whether it is infant, or whether it is child, right? Whether it is adult, infant, or children, yes, the number of chest compressions in all the scenarios is always same, 100 to 120 per minute, right? 100 to 120 per minute. Clear, guys? The funda is clear now in your head. The number of chest compressions, be it adult, be it child, be it infants, no matter whoever comes, it is always the same. Number is always the same, right? What differs is hand placement, right? What differs is hand placement, all right, and the depth. So hand placement and depth of chest compressions is different in all the three scenarios, right? It is different in all the three cases. Clear? Moving on to the next question. Now this is interesting. A 45-year-old male who was a case of polytrauma due to road traffic accident came to casualty, right? And you are posted in casualty department. On examination, blood pressure is not recordable. carotid pulse is not felt. Immediately CPR is started according to ACLS guidelines, right? The monitor showed ventricular fibrillation, right? The dose of shock energy to be delivered in this patient would be 200 joules of asynchronous shock, 300 joules of AC shock, 200 joules of synchronous shock, or 300 joules of synchronous shock. Baljinder is asking some questions. Sir, in children what we learned is 15:2 means 15 compressions and 2 breaths means 60 to 80. Isn't that correct? Okay, Baljinder, I'll come to that. Option A, that is 200 joules of asynchronous shock, is what Nisi is telling. Kartika says option A. Medico VH says option C, that is 200 joules of synchronous shock. Gayatri, Stardust, Baljinder, Gayatri and Stardust says option A, that is 200 joules of asynchronous. Baljinder says C, that is 200 joules of synchronous shock. Alright. So first we have to understand what is the difference between synchronous and asynchronous shock, right? See, this is your ECG wave normal PQRS complex, right? So this is your P, Q, R, S and T, right? Now what wave did we get here? It was ventricular fibrillation, right? It was this wave that we are getting, right? So when we say synchronous shock, what do we synchronize it with? The shock energy is synchronized with QRS complex, right? When we give synchronous shock, it is synchronized with QRS complex, right? Whenever the QRS complex comes, the shock is to be delivered, right? But in VF, are you able to distinguish and tell me where is the PQRS or QRS complex here? It is just fibrillatory, flutter fibrillation, right? This is what happens, है? So during these times, what happens is you are not even able to distinguish the QRS complex. So how will we synchronize, right? So here what we have to do, here the delivery of shock is always asynchronous, right? The delivery of shock is always asynchronous, correct? Now the difference between 200 and 300 joules, right? For that we need to understand the types of defibrillators, right? There are two types. One is monophasic defibrillator. The second one is biphasic defibrillator. Mono means one, bi means two. That means this is depending upon the flow of current and the cycle, right? With monophasic defibrillator, the current intensity is 360 joules, whereas with biphasic it is 200 joules. That is the maximum current intensity, right? So here the shock energy now we know, and which is preferred? Always biphasic is preferred, right? हम घर पे बोलते हैं ना, we say ना, when we are attaching the adapter or monitor, we say 3 phase वाली pin or 3 phase, because earthing is there for that pin, right? The current is complete, circuit is complete, right? Same way biphasic is preferred more than monophasic, right? It is better, the delivery of shock is complete, right? So 200 joules is the maximum current intensity in biphasic. So one, we know that it is 200 joules, and shock, it is asynchronous, right? It is not synchronous as in other scenarios, right? And whenever we have asynchronous and synchronous, in synchronous the shock intensity starts with lowest, that is 50, then it will go to 100, then it will go to 200, like that it rises, right? If it is 360, then it will be 50, 100, 200, 360, 300 and 360, like that. Clear? So in synchronous, we always start with lower intensity of shock, but when asynchronous or defibrillation, we give the maximum intensity of current. Clear between these two, right? So one, we know that it is not a synchronous shock, right? It is a asynchronous. So only option here is option A. 300 nahi hai, the option should be 360, then we would have considered this, right? 300 is not the current intensity which is correct. Clear everybody? Yes? Now coming to the question of Baljinder, in case of children we learned that 15:2, right? What is 15:2? Yes. Chalo, let's revisit the basics of CPR, right? CPR, that is cardiopulmonary resuscitation, right? What are three things or pillars of CPR? One is chest compression. C, it stands for chest compressions, right? A stands for airway, and B stands for breath. So three things for CPR that we need to know. It is CAB, that is chest compression, to be started first. We know what are the depth of chest compressions, what is the rate, 100 to 120 per minute, right? Then we maintain and manage the airway, and then comes breath. So what is the breath that we have to give to a patient, right? I'll elongate that. What is the breath that we have to give to a patient? In adults, we give 8 to 12 breaths per minute. In adults, we give 8 to 12 breaths per minute, right? Medico, Baljinder, everybody, right? Whereas in children, we give 16 to 20 breaths per minute, right? We give 16 to 20 breaths per minute, right? Now, correlated with chest compressions. What is the chest compression? 120 per minute, right? How much is the chest compressions? It is 120 per minute, be it adult, be it child, right? So now, what is the CV ratio? Compression is to ventilation ratio. How much is the chest compression per minute? 120. How many are the breaths? It is around 8 to 12. Let us take 8, right? If I divide 120 by 8, how much will I get? 4 up and 4 down, right? I'll divide it by 4. So it becomes 30:2, right? For every 30 chest compressions, I will be giving 2 breaths. समझ में आया? Yes, from where did this ratio came? So chest compression is to ventilation ratio in adults is 30:2. Clear? Now come to the child. Right? How much are the chest compressions? It is same, 120 per minute. What is the ventilation or breaths that we are giving here? It is 16, right? So CV ratio is how much? 120 divided by 16. कितना हो गया? 15:2. Got it? Understand? Yes. So CV ratio in child is 15:2, whereas CV ratio in adults is 30:2, right? I'll come to the details of it. If one rescuer is present, if 2 rescuers are present, what will we do and how will we go about with that, right? So this is the basic thing that you had your doubt. So this is the specific that I have cleared. When we discuss more, when we discuss CV ratio and everything in detail now, we will discuss this why 30:2, when one rescuer is present, when 2 rescuers are present, what will happen in those scenarios, right? Chalo, moving on to the next question. A patient was brought to ER in unconscious, unresponsive state. Brachial pulse is not recordable. Central pulse is palpable. He appears to be breathing normally. What is the next step? He appears to be breathing abnormally. Recovery position to be given to patient to prevent aspiration. Evaluate the patient thoroughly. Give assisted breath to the patient, or start with chest compressions. What are we supposed to do in such scenarios, right? Write down your answers in comment section. Let me check those. Baljinder says it is option D. We will start with chest compressions. Gayatri says we will start with chest compression. Pistachio says option D. Alright, Kartika says chest compression. That is the first pillar of CPR, right? PK says it is option C, that is assisted breath. Nissi says option D, that is assisted breath. Chalo. The patient is unconscious. One thing. Unresponsive. Second thing, right? Brachial pulse is not present, but central pulse is guys palpable, right? If central pulse is palpable, Which is the pulse that we check for starting or for assessing? Always carotid, that is your central pulse, right? 1. So pulse is present, but patient is breathing abnormally. The breathing is abnormal, but pulse is present. So what are we supposed to do? Yes, we will put the patient in recovery position and prevent aspiration. We will evaluate the patient thoroughly. Yes, pulse is present but breath is absent. So in such scenarios, can we give assisted breath to the patient? Chalo, I'll give you 3 scenarios, right? Based on these MCQs, I'll give you 3 scenarios, right? Patient is unconscious. Patient is unresponsive. Right? Patient is unconscious, patient is unresponsive. The first scenario I'm going to give you, and write down in the comment section, alright? The pulse is present and breath is also present. Pulse and breath both are present. Yes, what will you do in such scenarios, guys? Tell me, what will we do in such scenarios where pulse and breath both are present? In the comment section. When pulse and breath both are present, we will just observe the patient till the medical response team arrive, right? Till the emergency response team or medical response teams arrive. Okay? Alright? What is the second scenario? What is the second scenario? Where pulse is present but breath is absent or abnormal or agonal breath. Pulse is present but breath is absent. What will you do in such scenario? We will just give assisted breath and wait for the emergency medical response team, right? EMR to arrive, right? Wait for the EMR, emergency medical response team, to arrive. Okay? Coming to the third scenario, where pulse is absent, breath is also absent. What will you do in such scenarios? In such scenario, we'll start with CPR. In such scenario, we'll start with CPR. So did you understand the 3 scenarios that you can encounter in your life? Here pulse is present but breath is absent. So what you will do? You will give assisted breath to the patient, right? If I would have said that the carotid pulse is not palpable, then you would have started with chest compressions. Did you understand the difference? Yes, Kartika, Baljinder, right? Did you understand the difference? Let me know in the comment section, so that we are good to move on to the next question. A 50-year-old female is brought to ER in an unconscious and unresponsive state, right? Emergency room. On examination, carotid pulse is absent. What shall be the correct sequence of resuscitation? ABC, that is airway, breath and circulation, CBA, CAB or BAC? Yes, what is the correct sequence of resuscitation? Patient is unconscious. Patient is unresponsive. What is the correct sequence of resuscitation? Option A, that is, Bhavnesh says option A, that is ABC. Baljinder says A. Kartika says A. Nisi says option B. Shilpa says option C, that is CAB. PK says B, that is CBA. Till 2015, right? Till 2015, for CPR, the correct scenario was A, B, C, right? But after 2015, the correct sequence for CPR is C A B. C stands for chest compressions, right? A stands for airway. A stands for airway, right? And B stands for breath. B stands for breath, right? Till 2015, the correct sequence of first we give air to the patient, maintain the airway, give breath, and then start chest compressions, right? But now what is the sequence that we follow? We follow CAB. This is the sequence that we follow, right? We first start with chest compressions, then we manage the airway, and then we give mouth to mouth breath. Everybody? So correct sequence is CAB. Understood this question? Yes? Correct sequence is CAB. So whenever CPR comes, the first thing that you have to do is CAB. Samjha everybody? Let me know in the comment section. Everybody understood this? Basic question, but this is where we tend to commit mistakes, right? And there's also one thing I would like to bring to your notice, right? Whenever we are solving MCQs, there are three scenarios that pan out in our life, right? One, we have not read that topic at all, right? हमने वो topic कभी पढ़ा ही नहीं है, right? Second, we have read that topic but not understood the concepts. Yeah, there is some problem with the concept. Yeah, it needs to be revisited, right? Third is, we have read the topic, we have understood the concepts, right? But what do? There are some silly mistakes which we performed while solving MCQs, right? Like this one. So the only way to improve this, and I'll tell you 80% of the times we are in this silly mistake category, right? The only way to improve this is to solve more and more number of MCQs, right? The more the number of MCQs you will solve, the better you will become at solving MCQs, and the lesser will be your silly mistakes. Did you understand this, guys? Right? So whenever we are solving MCQs from here onwards, you should ask yourself, whether have I read this topic? If I have read this topic, have I understood everything regarding to this topic, right? If I have not read that topic, that means it is completely new to you. You need to revisit that topic. If you have read it, understood it, right? Just because of lack of revision, just because of these silly mistakes you are not able to perform, you need to solve more and more MCQs. Automatically your grand test score, your subject wise score will keep on increasing. Okay? Next question. What is the longest time a rescuer can take to check for pulse? What is the longest time a rescuer can take to check for pulse? What is the longest time a rescuer can take to check for the pulse? I'm sorry. Option D, 10 seconds. Option D, Pistachio, Kartiga, Nissi, Baljinder, PK, Shilpa, right? Everybody is telling option D, that is 10 seconds. Alright, let us move on to the next question so that we'll be able to solve all this question together. What is the first factor to check in any emergency situation? Age of the individual. What is the age? According to that, we will start with the resuscitation. Scene safety, status of the victim, or we will call for the emergency medical services team or emergency medical response team. What is the first factor to be checked in emergency situation? What is the first factor? Option Nissi, Kartiga, PK, Shilpi, Yes, Janisha, Varun, Baljinder, all of you are telling that it is option B, that is scene safety. Varun says it is status of the victim. Alright, scene safety, I'll take it into account. We'll move on to the next question, then we'll come back to this again, right? What will happen if second rescuer is present? Like, suppose if Kartika PK is present at the spot, right? What if two rescuers are present, right? Instead of you alone, you are present with your friend. What will your second person do? The second person will get AED. The second person will start ventilation, that is mouth to mouth breath. The second person will call for help or will do all of the above activities, right? What will the second person do? I've got a question here. So my question is out of context, but sir, how to build confidence while solving MCQs? अगर 2-3 MCQs गलत होते हैं तो पूरा confidence लो जाता है. Okay. What a meteorite? Metroid, right? If I am pronouncing it correctly, I'll come to that in a moment. No, Baljinder, it is not ABC. ABC was there previously, right? Our resuscitation pattern, ABC was there previously, but now it is CAB. It is CAB, right? This is what we confuse, right? And that is where the examiner would like to harvest our weakness, right? Now it is CAB. Since 2015, it is CAB. Mark it, dal do. Option A is what Kartika says, he'll get the ED. PK Nissi Pistachio says option D. PK Nissi says option B, that is start ventilation, right? Varun says it is option B, right? Most of you are confused between option A and B, right? One more. What is the next step after defibrillation in CPR? What is the next step after defibrillation in CPR? The patient has come, you have given the shock. What will you do next? You will ventilate the patient. You will check for pulse or breath of the patient. You will continue with chest compressions or you will give adrenaline. What are we supposed to do next after giving defibrillation to the patient? Ventilate, check for pulse and breath. Baljinder says B, that is check for pulse and breath. Kartika says B, Dr. Metroid says B, Pistachio says B. Yes, all of you are telling that we'll check for pulse and breath of the patient, right? Chalo. We will come to the basics, right? This is your ACLS protocol, right? This is your ACLS protocol. But before that, let me give you a situation so that you will understand CPR and the situations better, right? You are going for a walk or stroll down the road, right? And you encounter a patient with road traffic accident. Or you are going out somewhere in a nice nature area, right? There is river by the side and you see a person drowning. Or there is a fire which is caught up in a building, in an apartment, and you happen to be there in the surrounding, in the vicinity of that, right? Or you encounter a person, a uncle in the party, right? Or in a mall, who has suddenly collapsed, who has suddenly become unconscious. What will you do in such scenarios, right? What will you do in such scenarios, right? It is a road traffic accident victim, suppose. What will you do, guys, in such scenario? The first thing to be done, or the first thing to be checked in such scenarios is scene safety, right? The first thing to be checked is scene safety. Now, scene safety for whom? Scene safety for the victim as well as for the rescuer. Scene safety for the victim as well as for the rescuer. Suppose it is a fire, right? There is a fire in the building, as we have discussed your scenario. Will you go there in that apartment where fire is there and try and resuscitate the patient there itself? No, right? You will take that victim out on the ground where there is no fire, then you will start resuscitating, right? Will you resuscitate a patient right in the middle of the road where road traffic accident has happened? You will first bring the patient to the side of the road, to the footpath, and then you will start resuscitating, right? Right? So this is the first thing to be checked, that is scene safety. That is scene safety. So first thing to be checked is scene safety. Verify scene safety. Clear? Next. Second, check whether the patient is responsive or not. We will check for responsiveness, right? Check whether the victim is now option 2 and option 3 can be interchanged, and most of the times they are done simultaneously, right? How will we check for responsiveness? We will tap the shoulders of the patient. Hello uncle, hello mister, are you able to hear me, right? Can you hear me? Mr. X, can you hear me? Yes, please open your eyes. That is how we check for responsiveness. Third, call for help. Third is to call for help. As soon as you see that the patient is unresponsive, you tell the people, please call ambulance, please call 100, or if you are there in US, you say dial 911, right? Everywhere we have seen this. So call for help, and this question was asked in INICT, right? The sequence. Fourth, you will check for pulse and breath. Which pulse will we check? We will always check for carotid. We will always check for carotid pulse. Clear? यहाँ तक सबको everybody is clear? So first thing to be checked in any emergency situation is scene safety, responsiveness, call for help, and check for pulse and breath. This is the order. यहाँ तक everybody is clear? Any doubt? Come on, let us go back to the MCQ. So what is the first factor to be checked in any emergency situation? It is scene safety. All of you have given correct answer for this, right? Now, what all are the things that is supposed to be done? Check for responsiveness, call for help, right? If it is in the mall or in the party, there you will get automated external defibrillator, which is to be attached, the pads that will say paddles to be attached on the chest of the patient so that the current is delivered, right? And if the patient is having no pulse, no breath, what we are supposed to do? We are going to start with CPR. And what is the sequence of CPR? CAB, chest compressions, airway and breath. So suppose you are doing chest compressions, what will your friend do? Your friend will call for help. He will get the AED if it is present. He will also check for pulse simultaneously when you are doing CPR, as well as he will give mouth to mouth breath to the patient. So what if the second rescuer is present in emergency scenario? He will start ventilation, call for help, get AED. The answer is he will do all of the above, right? If you are alone, right, then you have to do it by yourself. But if Varun and Baljinder both are present, what will they do? Baljinder will start chest compressions, Varun will do all of the above. He'll get the AED from the mall, he'll start ventilation, he'll also call for help, dial 100, all those things, right? In UK it is 999, okay. Baljinder says in UK it is 999. So you'll call 999 when you are in UK. Alright, clear? 2 questions solved from CPR. Also our basics are getting clear. Next, what is the next step after defibrillation in CPR? For this we need to revisit this, right? So this is how your ACLS protocol looks like, right? So we have started the CPR, we have attached the monitors, we have also attached the defibrillator to the patient. Now the rhythm is what we are monitoring, and the rhythm is shockable. Which are the shockable rhythms? VF and VT. So after delivering the shock, what are we doing next? Just look at it. What are we doing next? We are continuing with CPR for 2 minutes, right? We are continuing with CPR for 2 minutes, right? We are not checking for pulse and breath. After this 2 minutes of CPR, that is when we are checking for pulse and breath. Yes? So what is the next step after defibrillation in CPR? You will continue with chest compressions. So what is the triangle, the sequence? One is shock, that is defibrillation. Second, you will continue with chest compressions, right? Then you will check for pulse and breath. If it is not present, again you will give shock, continue with chest compression for 2 minutes, pulse and breath, shock. This is the cycle that you have to follow, right? It is nowhere in between that other things happen. Clear with this question? Most of you have mentioned that we will check for pulse and breath. No. Alright. Next question. How do we monitor breathing during ACLS? How do we monitor breathing during ACLS? ACLS means Advanced Cardiac Life Support. It is Advanced Cardiac Life Support. We'll monitor it with the help of stethoscope, ABG, chest rise or capnography. Yes, remember in ACLS protocol just now we have seen monitors are attached, right? So one ECG is being taken. How do we give oxygen? We intubate the patient, right? We intubate the patient and then again the monitors are attached, that is ETCO2, right? So ETCO2 will help you in monitoring the breath during ACLS protocol, right? All of you, most of you have given correct answer, that is capnography, right? Whenever it comes to confirmation of endotracheal tube or breathing, it is always one answer in anesthesia, that is capnography. All right. So coming to the question of Dr. Metroid, the context is that how do we build confidence by solving MCQs, right? So when you drove a bicycle for the first time, Metroid, did you fall down? Anna? When you were driving bicycle for the first time or for the second time, did you fall down ever? Right? Or when you were riding a bike, did you fall down ever from the bike or from the bicycle? What did we do? We again got up, again started riding it, right? But again we fell down, again we got up and again started riding it, right? So 1 or 2 or 3 MCQs going wrong right now is better than those MCQs going wrong during the examination, right? So if you make one MCQ wrong now, make sure that the same topic or the same MCQ is not repeated or made wrong by you again, right? That should be your target. It is absolutely fine to commit mistakes, but the mistakes should be new every time, right? Just make sure that whatever the MCQs you are solving, whatever the time that you have, as and when you are solving those MCQs, you should be sure that these 50 MCQs that I have got it wrong, I'll go through it, I'll revisit, I'll study the topics. Next time when anything comes from this topic, I'll not make the same mistake again, right? Got it? So with this, guys, we come to the end of today's session. I hope you guys enjoyed today's session, right? So if anybody of you is still looking to subscribe, just go to the Unacademy platform, subscribe, use the code Dr. Hitesh and you will be able to avail 20% off. Alright? So until we meet again, guys, I hope you guys enjoyed today's session. So until we meet again, this is your host, your mentor, your educator, your friend, Dr. Hitesh, signing off for the day. Alright, make sure you subscribe to the channel, you hit the bell icon so that you get notifications whenever we are coming up with the next sessions. Also, please give your feedback about how did you like the class. Alright, thank you Mr. Qureshi, thank you Kartika, thank you Sahi, yes Baljinder, thank you all for joining in. I hope you guys enjoyed today's session. Lot of such sessions coming up your way in the coming month. Alright, so until we meet again, guys, see you. Bye bye. Stay blessed, stay disciplined, and stay motivated.